Emergency Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you do not have an audio capable device, a Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that are not verbally be asked must use the question function. All questions should be directed through the chair. And for attendance purposes, could you acknowledge that you are here as I see you? Jim Cooper?
Yes.
Meredith Lepre?
Yes.
Malcolm McNabb?
Yes.
Melissa Murphy?
Here.
We also have Libby Gibson, Town Manager.
Here.
Roberto Santamaria, Director.
Here.
Jason Bridges, Select Board.
Here.
John Hedden, Board of Health.
Here.
Greg Corbo, Town Council.
Here.
Kathy LaFave, Board of Health.
Present.
And Amy Baxter.
Here.
Okay, I think they covered everybody. So I'll turn this over to Roberto to get us started.
Hey, so it's been an eventful week. And, it's been a little tough. So what we saw yesterday, showing up yesterday morning or afternoon, was the Biobot sewer report coupled with the 28 cases that we saw from the testing, saying that we're going to be expecting about 40 cases a day based on this report that just came out. That was this week's report, which is that 40 cases, if you remember from the discussion, probably 2-3 months ago now when we were first talking about it, when we said, getting closer to between 30 and 50 cases a day, that's when we would look at going back to masks. And when it hit 40, it jumped from 10 a day last week to 40 a day yesterday. So we felt that it was really important to move forward with a mask order at the minimum. Then we discussed the possibility of also a occupancy restriction. So that's where we are today. So what I'll go on, we'll just jump right into that agenda item if you don't mind. So what we're going to do is I will share my screen shortly. First, I'm going to share a quick quote because this is exactly what's happening here. And then I will share the law that we're going to be using as the basis, which is MGL 11, Chapter 122. And then we'll go into the actual recommendation order that we received about half an hour ago. So Greg, if you're okay with explaining Chapter 111, Section 122 when I pull it up, if that's okay. So let me share the screen real quick. So what you should be seeing here is a quote, which is exactly what we're dealing with right now. If you see the article on the Inquirer Mirror today, Dr. Drazen from the New England Journal of Medicine was talking about how at the time when we removed the mask order, it was the right choice because we were working off the information we had at the time. And the same thing with that original law. We were working off of Chapter 111, Section 31A, which requires that whole public hearing situation to pass any sort of order or regulation. what we have since found out since about May, when the original orders were removed, is that we can actually use section 111, section 122. So Greg, can I bother you to give a quick elevator speech on what section 122 can do for us?
Yes, thank you. Through you, Mr. Chair. Good morning. This is Greg Corbo from Town Council's office.
Nope, you're muted, Greg. You accidentally muted.
Sorry about that. Good morning through you, Mr. Chair. This is Greg Corbo from KP Law, Town Council's office. And I can explain to you what the source of the Board of Health's authority is with respect to regulation to prevent the spread of COVID-19. As Roberto mentioned, pursuant to Massachusetts General Laws, Chapter 111, Section 122, the Board of Health has the authority to issue orders to prevent all nuisances, sources of filth, and causes of sickness within the town. This authority is coextensive with the authority of the Board of Health under Chapter 111, Section 31, to enact reasonable health regulations. And so the standard is one of reasonableness. And so as long as the Board of Health's regulation is reasonably related to the protection of public health or the prevention of causes of sickness, then it is something that is within the authority of the board to enact. And so all that you're required to show is that your regulation will in some way further the protection of public health and safety. You're not required to guarantee that the regulation is going to protect public health and safety, only that it is reasonably likely that it will. So, you know, given the evidence that we have in front of us today, that there's a significant uptick in the number of positive cases and hospitalizations, that we have this Delta variant out there that seems capable of breaking through even to persons who have been vaccinated. It appears that the time has come once again for the Board of Health to take action. Is my understanding that the health department is recommending at this point that action be a return to a requirement that individuals wear masks or face coverings while indoors in public places, and possibly a rollback of occupancy limits to 75% occupancy. I have provided Roberto with a draft order with respect to the mask requirement. And if you decide to address the occupancy limits, then I can add that to the draft as well.
Okay, sorry, I didn't realize I was still muted. So with that discussion in place, we have the new draft order that's here. I did email it to the board, and it will be part of the packet after we did just get it, and we're adding it now. So what we're doing here is these first whereas is providing the information that Greg just discussed, and then going forward to the meat of it, using Chapter 111, Section 31, and Section 122, we're going to be discussing these particular orders. So I can go through each individual section one by one if it's easier for the board. Okay.
I think so.
Okay. So Section 1, it is a recommendation. It's really important to understand that we're talking about just a recommendation for number 1, that all persons who do not reside in the same household maintain a physical distance of 6 feet when possible when in a location that is open to the public. It's the recommendation of social distancing. Section 2, in addition to physical distancing and in an effort to protect public health, all persons, including customers and staff working in areas accessible to customers, shall wear a cloth face covering that covers their nose and mouth, such as a fabric or surgical mask, whenever they are indoors on the premises of a business, club, place of assembly, or other place that is open to members of the public, including but not limited to retail establishments, restaurants, bars, performance venues, social clubs, event spaces, places of religious worship, and municipal buildings. So this establishes the face mask indoors, specifically indoors is what we're looking at. Number 3, this order shall not apply to informal gatherings at private residences in which no compensation for the use of the property is paid to the owner. So it's exempting that private property issue, which was one of the problems we were having last year.
May I ask a quick question on this point, Steve? It's Melissa. Does that exclude then, or does that infer that for private events where someone, is maybe hosting a wedding at their own property, they would not need to require masks, but if someone is renting a private property to host an event, masks would be required? That's the differentiation?
Greg, correct me if I'm wrong, but correct, I believe.
Through you, Mr. Chair. Yes, that was the intent in writing that provision, that if you are, having your own private gathering, then, you're not going to be required to have your guests wear masks. It's more, I think, intended to address issues of, people having barbecues and, more informal types of events. But, if you are renting out your property and receiving compensation in return, then, in my opinion, you should be treated just like a business and have to comply with the mask mandates.
And the mask mandate would be for interior only. So if I'm renting a property and have a catering company and I'm putting people under a tent with no sides, this would be moot. I just want to make sure I'm understanding it and that we're clear.
Yes, that is correct. As written, and at this point, it is only applying to indoor places that are open to the public.
Okay, thank you.
Any more questions on those first 3? Okay.
Mr. Chairman, I have 2 questions.
Go ahead, Malcolm.
What about children, small children? Is there exemption for certain ages or not?
That is addressed later in the regulation.
And what about enforcement? I have a business, someone refuses to wear a mask. What do I do?
That is also on the next page.
Okay, I'll wait then.
I'm sorry, Steve, Melissa, one more question. On number 1, is this physical distancing, is this recommended for outside, or is this everywhere? In every instance, we're recommending that?
We would recommend it in every instance. That's your best approach. But it's, like I said, it's a recommendation.
Okay.
So we'll move on to the next one. Section 4, this order shall be in place until it's rescinded by the Board of Health. That one's pretty self-explanatory. Moving to the next page. Wearing a mask is not a substitute for physical distancing. It is recommended that all non-vaccinated individuals wear a mask in all public places. Again, it's a recommendation.
Mr. Chair, Melissa, again, on this one, and I'm happy to have this looked at later in a board discussion, but I think those should be 2 separate points. I just feel like it's important enough to distinguish the 2, and I understand why they're together because they somewhat make sense, and also it feels like recommendations should be similarly grouped so that people can easily figure out in this order which ones are the finable offenses and which are just recommendations. So if there's a way to segment these in that way, I would recommend that, because as it's written, I think it's causing some confusion about which ones you can be penalized for.
So,
Through you, Mr. Chair, it seems like that would be a simple issue to address by simply making the second sentence of paragraph 5 its own paragraph, which would be number 6, and then renumbering everything accordingly.
That would be fine for me. And through you, Mr. Steve, you know, perhaps that, I don't know if we need to say title, you know, recommendations 1 through whatever they are, and then order 1 through whatever they are, or at least similar, you know, group similar items together. And that may be a little, I don't know, overly editorial, but I just want to make sure that it's very clear to the public what the recommendations are and what the orders are.
okay.
Yes, I can do that. Basically what I would do, I guess, is move would reorganize it a little bit, but that's doable.
Yeah.
But in general, the wording is okay. Correct, Melissa?
I'm comfortable with it. Thank you.
Okay. So it's just a matter of ordering, because what we're going to end up having to do is kind of massage this order, move the orders around. If we're going to be changing any substance, then I want to do it live.
Yeah, absolutely.
Okay. Number 6, notwithstanding any provision in this order, pursuant to guidance issued by the CDC, face coverings should not be placed on young children under 2 years old. Anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, or anyone who, due to disability, is unable to wear a mask. These were the same provisions from the previous mask orders, that if you are quite literally physically unable to wear the masks, then you do not do so. To the extent necessary, this order shall be enforced by the Nantucket Health Agent, Assistant Health Agent, and all other agents for the Board of Health. So what we have voted on before in the previous orders was that we had appointed all the inspectors, police and fire as agents. So that's where we are for the sake of COVID enforcement. Number 8, whoever violates any provisions of this order may be penalized by non-criminal disposition process as provided in Mass General Law, Chapter 40, Section 21D, and the town's non-criminal disposition bylaw. Pretty self-explanatory there. If non-criminal disposition is elected, then any person who violates any provision of this regulation shall be subject to, for a first offense, a written warning. For a second offense, a penalty in the amount of $100, third, $200, and fourth, or any subsequent offense, a penalty of amount of $300. Each day or portion thereof shall constitute a separate offense. If more than one, each condition violated shall constitute a separate offense. And that is the entire order.
Mr. Chair, for Roberto, again, I'm a business owner and someone refuses to wear a mask and they're not disabled, et cetera, et cetera. Who do I call?
They can call us because the order is specifically written for people. A specific person can be we can write a violation ticket for it. And it is difficult to do that enforcement. It is an issue we were running into with the task force, but it is possible. So Jericho and I have been working together with the task force over the last year to do this. So we're looking at the enforcements again in the same possible way. I'm going to go ahead and stop sharing the screen so that we can see each other. See that Meredith and Meredith and Melissa have their hands up.
Meredith, go ahead.
I know we probably have to do it this way, but I feel like we're kind of past the written warning. Like, if you don't know that you should be wearing a mask, then I kind of feel like we're like the horse has left the barn. Like, people need to be wearing masks, and I don't really feel like a written warning. I know that's probably easier, and I'm not saying that we have to take it out, but I just sort of think it's not March 2020.
Melissa?
Thank you. What about service providers in the trades who are entering private residences? Would they not have to wear masks in this instance?
I'm sorry, can you say that again?
Sure. So service providers who are entering private residences, plumbers, electricians, carpenters, property managers, cleaners, if they're entering private residences, as this is written, they're not required to wear a mask unless I'm misinterpreting this. And is that important for us to consider at this point? Is that at least important to put in as a recommendation that we recommend that happen?
Theoretically, no, they don't have to, but they should. They should definitely be wearing masks. And that's part of what number 5 is, if I'm not mistaken, where it says wearing a mask is not a substitute for the 6 feet of distancing. And especially if they're non-vaccinated, they should always be wearing a mask. So it is in the recommendations, and we can definitely explicitly put it out too.
In my opinion, if I may, I think it's important to spell that out so that we have some trade clarity. I don't know if anybody on the trades is on the call and will make comment, but I think it's really important that we're as clear as we can be on the recommendations. That this is not part of the sort of finable business order, but as a community, we're strongly recommending if you're entering anyone's home, physical distancing is not possible, that you wear the mask. And certainly it may be very important to add, Roberto, that if you're unvaccinated, we recommend you wear a mask indoors and outdoors. I understand that's the CDC guidance, but if we're going through the trouble of writing this order, we might consider putting that in.
Correct. And if a business wants to put in, or even their own private residences when they're bringing in people and things like that, if they want to do their own screening, absolutely. There are plenty of businesses around the island that still, I had my temperature taken walking into. Something as simple as, here, smell a coffee. If you can't smell it, get out. Things like that. But if a business wants to do that, they can. They can implement as many screening tools and mandates as they want. It is their private business and their private residence.
Jeremy, go ahead.
I've got a problem with, if we're going to pass this order, why are there recommendations in it? If you're just recommending things to people, that has no teeth to it. If we're going to pass an order, why don't we have the order that what we want these people to do? I mean, it's simple to pass an order, but if you're going to say, well, we recommended you do this and we recommended you do that, then that has no teeth in the order whatsoever.
So those
So what Melissa just said, those people that are entering your house, we should make a decision. If those people are entering your house, that either they should or they should not. Don't say, I don't like to agree to something that says, we recommend you do this. I don't want to recommend something. If we're going to pass an order, we say, this is in the order. If you're entering someone's house to do cleaning or something like that, you will wear a mask.
we cannot legislate what somebody's doing in their own private home.
Okay.
Just to follow up on that, if I might, some businesses who have reached out to me have said that, Jim, a mask recommendation from the board, along with the mandate for masks indoors, they feel like that is supportive and compliance regardless of our ability to enforce it. So I guess I'm saying that as long as the town is in good, clear communication with industries about what we are recommending for guidance on how to navigate this particular part of the pandemic, that goes a long way in terms of giving them the support they feel like they need to interface with their customers and their clientele.
Was that the last part of the order?
Yeah, those just the 9.
Melissa?
I guess what we don't see in here then is what had been possibly talked about to be included is any occupancy restrictions. Is that something we're going to be talking about separately? Or have you made the decision to leave those out?
So one of the conversations we were having, especially last night, once this all brought up, the occupancy restriction, I know that the select board had a real, we had a good discussion yesterday about whether or not that's having both be absolutely necessary. We are already not requiring, but allowing outdoor seating. A lot of the occupancy is moving outside. We would love to see more people outdoors. So it would, after having discussions with and advice with others, it would probably be best to, like you were saying yesterday, to take a small baby step in this case. We know masks work. So masks are probably the single biggest move. We probably don't need to move to occupancy restrictions yet. But I would leave that entirely up to the board.
It seems like yesterday the occupancy could from on the table, and today they are not really, because the select board wasn't totally for it, which I understand, but I think that we know that that also does work, and it's not shutting everything down, which I don't think that we should do, but I do think that we know that there have been a number of restaurants and other places where people congregate that have been shut down because of exposure. So, I mean, I think it's not, no offense to the select board, it's not really their call to say that, I mean, just, or is it maybe, I don't know. I guess I feel like that might work.
No, absolutely. I understand how it looks. I'm sorry. Let me explain a little bit more there. So one of the things that was brought up, and I was looking into it again yesterday, is that a lot of our, in the phase 4 reopening plans through the state and through the outdoor seating, a lot of the occupancy, indoor occupancy, was already stopped at 75%. We, in many of our restaurants, are already doing only 75% indoors, because they're supplementing the outdoor. They're only ever able to do 100% of their occupancy when you include the outdoor seating. And Amy, correct me if I'm wrong on any of this. So to my knowledge, most of our indoor areas are already operating at that 75% capacity. So because of that phase 4 reopening plan and the outdoor seating plan. So throwing this on top of it, throwing in a 75% occupancy on top of it, is like saying, I'm going to throw my extra $1 on top of your 1 million. It doesn't really make a difference. We're kind of at that point of negative return asymptotically.
Let's go to Jason. You had your hand up before.
Yeah, I just want to clarify, like the select board knows exactly what lane they're in, and we have Melissa as our rep, and we send our information to them. But I think as the elected policymakers and who appoint the Board of Health, we have a say on implementation. I think that's what we were talking about last night, is not questioning really the order. It's really trying to understand it and how do we implement it, because we get all the calls and we get all the emails. So we want to understand it so we can explain it, because we have the megaphones out there to, when we get the calls from the businesses, to be able to help them understand the orders. And I think that's where the conversation was last night. We totally understand that kind of where we're at in our lane, Mary. I just want to clarify that.
Okay.
And
Yeah.
I think Melissa does a really good job of getting these clarifications so we can help everyone.
Okay, thanks. Malcolm, go ahead.
I'm sort of with Meredith on this. We have to remember this is August and people are telling us there are 70,000 people on the island, and I don't see that getting any less for the next couple of weeks. I think the board stating that there's an occupancy cap is sending the right message. It will remind people not to have big crowds inside, even if it doesn't happen a lot. I would be very much in favor of some occupancy cap. I don't know, 75 is magic number, whether it should be 67.2, I don't care. But I think I would strongly support an occupancy cap. I think it's the right thing to do at this particular time, given the craziness of this island right now.
Melissa?
I guess I have a couple different thoughts about it. I appreciate the fact that a blanket occupancy limitation on businesses may not be the best approach. And I think that if we could develop a more nuanced recommendation to address specifically where we think the outbreak is more possible. Some feedback I've heard is bars and nightclubs, for example, or occupancy after 10 p.m. when the dinner service is over at restaurants that convert to a bar scene. That seems much more appropriate in my mind than affecting dinner service, where we're seeing, likely less crowding and less transmission. It's already organized in some way by seating. And my only other thought on that, we've seen this, I think, in New York, and I can't remember what other city right now, but is businesses asking for vaccination requirement to bars and nightclubs. So if you're going to see a music show and you've got your ticket, you have to show proof of vaccination. I'm not sure if that's the route that we want to go down, but if I were to be in support of any occupancy reduction, it would need to be very specifically nuanced to the businesses that are impacted with high risk of transmission.
Jim?
I just have one question. On the last thing on this order says that the town offices will go into appointment only. Do you think that's really necessary? Or will that come out of here and that decision is up to the select board?
I would say that all the indoor is necessary at all locations. Jericho, I saw that you had some recommendation too.
Yes, I think that the points of contact with repeated exposure risks do to accumulate very rapidly. The exposure limit is 15 minutes per 24 hours cumulative in enclosed close areas. That's just building up. The exposure risk, especially around kind of core infrastructure departments, probably should be protected.
Melissa?
I guess my only other thought on the occupancy issue, if this board feels strongly about it affecting all businesses, including retail, that I think, and I mentioned this last night at the select board meeting, again, I think we need to be nuanced or be more precise, more targeted, so that there are some restaurants, for example, that can have greater capacity outdoors and they can still keep their full capacity numbers, but serve that population outside, and they should have the flexibility to do that. So I'm really not particularly interested in limiting in blanket policy, because I think we do know so much more about how the virus is spreading, and we can choose to be much more targeted in our approach. at this point.
Meredith?
So, I mean, couldn't we just say 75% of all businesses indoor? So if they can seat more people outside, then that doesn't, I mean, you're less at risk to get it if you're sitting outside. So and we could say all, I mean, if you're wandering around a store for 15 minutes and there's somebody in there, Delta takes less time to get, then I don't think I would exclude stores versus bars. Like, couldn't it just be a blanket for all businesses? I mean, I just think, and I usually agree with Malcolm, like, we just need to really, I think, be
If,
strong coming right out at this, rather than sort of, let's start with the masks and then we'll see, and then it'll be September. Like, what?
if I may, both
Jericho,
Meredith-
go ahead.
oh, apologies. Both Meredith and Melissa's point, I think I have something somewhat germane to that. We're looking at the very early stages of transmissibility research with respect to Delta specifically. Amongst unvaccinated, the early reports, they're not yet studies, are suggesting that the communicability is significantly closer to chickenpox than anything else, and that it is several 100% higher than heirloom or wild type is. Additionally, among vaccinated, I'm following a particular study coming through the UK right now, the REACT study, which is showing that there is a reduction in transmission between vaccinated individuals, but that it still occurs, and that accounting for Delta's higher transmissibility rates, the protection that you're given by the vaccine versus Delta is roughly what it was unvaccinated versus the heirloom types. So I think that while we do not know the exact dimensions of the transmissibility rate, the early evidence that we have suggests that we should be taking it seriously, and that because of the way that these case growth curves work, that if we should start stronger than we think we need and work our way down. Just as more data gets in, we'll know the actual exact transmissibility rates or something much closer to that. But as of right now, we're working from a place of not complete knowledge, and as a result, we should be more protective rather than less, if I may.
Malcolm?
Yeah, I think occupancy is important, and I agree that we have to figure out how to do it. If you have 75% occupancy rate and a particular restaurant has all their 75% peoples at the bar unmasked drinking, that's just not acceptable. So I think we have to deal. I think Melissa's right. I think it has to be perhaps specific. If we have these 70,000 people on the island and a significant number not vaccinated, and they're all hanging around a bar in close contact without masks, very hard to drink with a mask, that's going to be a spread. That's going to be an issue. And I think I agree with Jericho. We need to get ahead of it, not behind it.
Anybody else?
So there seems to be a lot of nuance when sort of occupancy. So what I would suggest is we can do just max day, and then we can flesh out a plan for any sort of occupancy issue that we can bring up. And we have a board meeting in 2 weeks anyway.
Go ahead, Malcolm.
2 weeks, that's not, no.
We can post for next week. That's fine. It only takes 4
If we're, I think I would ask the staff to really flesh out a plan about occupancy. Not just a general one, but a smart one. And then we need to reconvene soon, not 2 weeks from now. If you say we're going to have 40 cases a day, 2 weeks from now, we might have 80 cases a day. So I think we have to get ahead of the curve before the curve gets us.
Melissa?
Thank you. Yeah, I would make a similar recommendation that we move forward in voting on this particular order today, and then see if we can't meet early next week to flesh out occupancy. I do have another couple of questions on the order, but I'm happy to save that for when we determine the path forward regarding occupancy.
One question, like on the occupancy point that I would have for Jericho or maybe Roberto is, what happened in P-Town, who's, a couple weeks ahead of us in instituting their mandatory orders. And I think it was a mask order. And I just saw recently that the positivity rate when they first started was about at 15%. Since they've had the order in just as of yesterday, they're down under 3. So did they, and if you've ever been to P-Town, it's nothing but restaurants and there's 60,000 people a day there like there is here. So do you know if they put any occupancy restrictions on the businesses when that was in their order?
I can check. I do not believe so. I believe it was just the mask order. And they had given the town manager, town administrator, the ability to create occupancy restrictions if needed. But like I said earlier, we know that the masks work. And that's, I think, your point.
Do we have any, we gonna take any general public? I can't see if any hands are.
Amy has a comment before we take any.
Go ahead, Amy.
Thank you so much. I was gonna say a couple things. I'm just looking at Provincetown, and they did, I believe in the nuance too as well, because you can do a 75% at, say, one of the nightclub licenses that have 300 occupancy, and you still have 225 people gathered together. They went specifically as far as indoor bar and dance venue customers may only remove face coverings when seated at tables or seated at a bar. Standing or ordering at the bar must be masked. Guests must be masked on indoor dance floors. So they went into some nuance, because that is an important distinction. When we went to occupancy restrictions in these establishments prior, we were not having bars. We were only having food service only. So we're now in a situation where you're looking for an occupancy restriction where you're having those activities that we did not have before. So we have to, and we also have definition issues with indoors versus outdoors, if they have sides up or they have 50% down. So there are a lot of nuances there that we know from experience now in the past 18 months that we have to deal with. But Provincetown, I'm looking through their mandate right now, and they definitely did get into some of those nuances too that might be helpful for us to take a look at.
Melissa?
Thank you, Amy. Those recommendations regarding, how customers are expected to mask inside as opposed to just the staff masking, I think are important to include in this mask order, because I don't think there's a lot of or enough definition in this order that sets up expectations for customer behavior, particularly at those high transmissible points, bars, nightclubs, dance floors, those kinds of things. And I'm not sure, I think that's why there was some conversation around the possibility of proof of vaccination status for those types of venues as a way to mitigate occupancy limits. It would be somewhat their responsibility and customer self-selection. But I'm not sure what of that P-Town order, because I don't see it, would be useful to adopt in this particular mask order.
Any other questions? Go ahead, Jason.
I think this would, when this gets passed, is this immediate as it's voted on?
We would need to set it at the vote.
Can you say that one more time, Roberto? It cut out a little bit.
We would need to set an effective date when we vote. Did you want to take public comments, Steve? There's like 12.
Sure, we could take a couple. You don't see.
Bruce, you're up. Just make sure you unmute.
Thank you very much. I'd like to express a few concerns for a moment, if you don't mind, please. I take Jimmy's comments quite seriously and think it's a good comment about the difference between a mild request and an order or a recommendation. Yesterday at the select board meeting, we heard Jericho tell us that contract tracing takes time, detective work. We heard Roberto explaining that some of the spread is from restaurants, both staff and customers. We have some incidents out here in the West. We have a very popular restaurant, mostly tented customers. They had an exposure on the 25th of July. No one was told about this. They had 4 more exposures on August 1st. No one was told about this. There doesn't seem to be a policy for dealing with this, especially in restaurants. Even though they're tented outside, the people are still lined up inside to use the restrooms and to chit chat and stand out of the wind and whatnot. We heard today about the risks of repeated exposures. There doesn't seem to be an obligation for a restaurant to inform the public that there have been exposures. This particular restaurant takes phone numbers in order to see people. It's easy to contact them. Many of the neighbors out here feel very exposed, having been at this restaurant several times over the last week, and then only to find out in the Boston Globe and in magazine that the staff is exposed. And the health department, the Board of Health, the Boston Globe basically gave permission to stay open. So we seem to be lacking a policy. And while this emergency order, I think, is a good step, I'm wondering why we don't have a policy to inform the public that, hey, this restaurant had an exposure. They've opted to stay open, which many of the restaurants here would at least close for a day to sanitize and allow contact tracing. But we have a place here where it's just staying open. People don't know what's happening. And the Board of Health, the health department knows there was an exposure, but they still don't notify the public, hey, you want to make an informed decision to go there, go ahead, but be aware of the risks. So what I'm seeking is, why don't we have a policy about this instead of just tiptoeing around this? Thank you.
Thanks, Bruce. Who wants to answer that? Roberto, or maybe Greg, if he's still on?
We follow all the policies set forth by the CDC. There is a policy written, and it's no different for a restaurant, whether it be Millie's, which is what you're talking about, or Fairgrounds, or Corner Table, or wherever. It's the same policy for all of them. And that individual contact, when a waiter, waitress, server is showing up at your table, does not count as a close contact. We can move to the next, if that's okay. Dr. Toomey?
Yes, can you hear me okay? Thank you. Well, thank you, Roberto and Jericho, for raising the attention there. I just wanted to sort of mention another point, which was the possibility, or at least for you perhaps to consider this, of having other mitigation measures and maybe raise the question on testing. And I wanted to mention that for the olfactory testing, which we've been in discussion with you guys for a bit, That just started in a clinical trial in Bainbridge. So that could easily be added on to a different site there if that was of interest. And I should also mention, I think you're very well of the facts that there is olfactory dysfunction with Delta, especially in the people that are already vaccinated. And as you are probably well aware, the CDC study showed that a large percent of that transmission was in people that were vaccinated. So I agreed it's only a small percentage of the vaccinated people. Wanted to let you know that this would be possible and to really ask the question if there was interest in the community of perhaps participating in such a study. That's it pretty much for my comment.
Okay. Thank you.
I can field that one if you'd like. Yeah, no, I think the olfactory screening technology is potentially very useful. I think that, you know, if any business or any private agency wants to utilize that screening technique, that they should definitely do so. It is potentially quite effective if deployed correctly, and I think it could be a great help. Unfortunately, it's not really the kind of technology that we can be integrating into town operations without a more concrete deployment plan, basically. And I know that I'd love to see any of the documentation around the current pilot plan. I'd be happy to take a peek at that if you want to email it my direction. But yeah, I mean, I think an olfactory screening tool could be helpful in certain circumstances, but it's not the solution to our particular set of troubles, which is less the screening as it is the masking and the behavior that's going on the island than anything else.
Nicole?
Hi, Roberto. Thank you. My name is Nicole Tara. I am a year-round resident of Nantucket as of beginning of 2020. And also professionally, I am in the sports, entertainment, and music business. And as you can imagine, we've been dealing with this professionally over the last year and a half in mitigating the pandemic and now dealing with vaccinations and whatnot, moving forward into our industry as we reopen. I guess I joined today under the premise that I want to offer maybe a differentiation of opinion. I caution this board in going down the road of trying to mandate their way out of a pandemic. I think we've proven certainly that we've gotten to a place as a society with a readily available vaccine and with over 70% of people in the state of Massachusetts vaccinated, that we need to trust the process and trust the system, if you will. I don't think it's our job as a society and certainly as a community to protect the unvaccinated beyond their ability to adhere to a vaccination if there is their personal choice. And what I think we're potentially creating with a mandate such as what you've proposed is a system where we are disincentivizing people to become vaccinated. And I think that's something, if you look to what the federal government has been struggling with and really at the state level as well, we certainly don't want to be in a position where we're telling everyone, regardless of their vaccination status, that they have to adhere to the same set of protocols. There should be a benefit for those that choose to move forward with the vaccination. And so I caution this board to go down this path of regulating it, because one, I don't think it's certainly enforceable to the extent that you would hope it to be. And I think it ends in a place of disdain and distrust of public officials such as yourselves. And I think it leads us to a place that will ultimately not end up accomplishing our objective. And furthermore, I would just add one note. I thought at the top of this call, I would caution you from a legal perspective to really think about the bylaw that you're citing to be able to enact such a regulation for the town. We can pretend that it was written for COVID. We all know it wasn't. I think you're opening yourselves up to some legal disposition here. And I think there could be some negative legal consequences that the town might be at fault for. So I would just encourage you to think about that. I think there are plenty of businesses here that are able to make decisions for themselves. I would encourage businesses who feel unsafe to require masks themselves, as they have done on island for the last several weeks and months. And for those that feel safe in operating, for them to be able to do so freely, and for consumers to be able to, make that decision. Thank you.
Thanks, Nicole. Melissa?
I just want to add a comment that while I certainly respect the debate about whether or not policies are protecting people who choose to be unvaccinated, we still aren't vaccinating children under the age of 12, and we're right on the precipice of sending our students back to school. And so a large part of my consideration as a voting member of this board and a member of this community is how am I going to protect everyone in our community? And that's the basis in which I'd make any decision today or going forward.
Jericho?
I'd also like to echo the fact that there are a pretty important demographic on the island that cannot get vaccinated right now. I would also like to say that my job is to keep everyone on Nantucket safe. And at the moment, the best way to do that is to get vaccinated. The reward you get from vaccination is not dying or being hospitalized if you catch, more likely when you catch COVID over the winter months. So there is a reward for vaccinating regardless of mask orders or occupancy orders, and that is being immune to a dangerous disease with potential long-term complications. So there are other people who, for a variety of medical reasons, vaccination either will not work or they have comorbidities, so that if their vaccine protection status is broken through, they are at extreme risk from death. People who have organ transplants, people who are immunocompromised, people who are in a variety of different conditions, who even with the vaccine are at a greater risk of death. And you cannot get out of a public health crisis with personal responsibility. If the last 20 months of America has not told us this, that individual choices do not apply when you have a self-replicating pathogen. This isn't smoking. This is something that copies itself and mutates and adjusts to our tactics and our technology. You can't personal responsibility your way out of a replicating pathogen. That just isn't how it works. It's not worked in previous problems. It's not worked currently. In the places that they have had success in combating, even pre-vaccine, they took this seriously as a public health and not a personal responsibility issue. And we have to be very clear on that distinction.
Thank you.
I know that we're going to lose the webinar in about half an hour. So do you want to continue taking public comment, or do you want to see the revised order that Greg?
Let's go. Yeah, let's go to the order.
Okay. So we see the revised order here, which is the same whereas, but we added the recommendation section. Greg added the recommendation section and then sparsed it out to where it says order. To my knowledge, the wording wasn't changed. And Greg, correct me if I'm wrong on any of that. So I want to see what the board thought of this new format.
Mr. Chair, through you to Roberto, I did also add a new paragraph 7 regarding occupancy. But based on the discussion that followed, I'm not sure where you stand with that. So that's just there for your consideration at this point.
So this is the substantive change.
Yeah, I'm a little uncomfortable voting on the occupancy thing as part of this order right now. I think we need to maybe address that in the next few days.
I would agree. I'm not comfortable with that as part of this order today. And certainly as drafted right now is not as nuanced as I would hope the final recommendation would be. And I understand why it was written in 10 seconds. So I think this debate deserves more time. The mask order, I understand, has a sense of urgency behind it.
And Mr. Chairman, I'll support that as one sort of pushing occupancy. I just encourage you as soon as possible to have a proposed rational, intelligent occupancy plan for us.
Okay. So I was just informed that the committee meeting that we were going to butt up against actually is in a different account. So we have plenty of time.
Melissa?
I have a couple of questions about the mask order. One is for performance venues. Would the performers be required to wear a mask when performing? So theater performances, singers.
If they're indoors, yes.
Mr. Chair, I think that's not reasonable. I mean, if a performer is, 6 feet or 10 feet away in a theater, I have trouble with requiring performers to wear masks.
They make masks for performers. That I know one of the music teacher at the elementary school had it. That is a special, so that you can still sing and they can be heard very clearly. So it wouldn't be like they'd have to wear a cloth mask or a surgical mask. They make specific ones for performance. So that's just my 2 cents.
Melissa?
I tend to agree with Malcolm. I think, our performance venues, particularly theaters, have taken a lot of caution to make sure that their actors and actresses and performers are vaccinated, and there's a certain distance from the stage to the first row. So I'm not sure that I'm 100% comfortable with that. And my second question, which we hadn't gotten to yet, was I'm still not 100% clear on the expectation of bar patrons. So if I go to a crowded bar at 10 or 11 o'clock at night, is the expectation that I'm in that facility with a mask on only when I'm ordering, or all the time? How are people drinking? I'm having a hard time reconciling how that's going to actually play out. And I really don't want to set up a situation in which we're penalizing businesses for customers' behavior.
Twofold on that. While you're consuming a beverage, food, things like that, you don't need to wear a mask. That's just where it is. We have never required it. But also along the lines of people being responsible for their guests, that's the same in every law. We don't allow dogs in restaurants, and if a dog shows up in a restaurant, we fine the restaurant, not the dog owner. If a person shows up with a really good fake ID and they sell them alcohol, the restaurant gets fined for that. If I now have military access, if I bring somebody to a base and that person acts up and drives drunk on the base, I'm held responsible for that because they're my guest. So it's not much different than any other law that's on the books right now, or regulation.
Then I would like to see some kind of amendment to this order that would not require theater, at the very least, theater and performance venues to have their performers be masked. I think they've had to go through extensive situations in which they've had to improve air quality. Many of them have made sure that their performers have a vaccination status that's, that they are vaccinated. And I think that we need to make sure that they're able to conduct their performances without that restriction.
I agree, because a performer on a stage is less risk than all of those people hanging around a bar. So.
Sounds good. How would you like me to word it?
I would agree to.
I can see.
Well,
I'll try to get it from one of the previous orders. Let me see if I can grab that.
might have to defer to Greg too.
Yes.
My law days have never existed.
Through you, Mr. Chair, what if we included language that says the mask requirement shall not apply to performers while they are performing, provided that they are at least 6 feet away from any member of the public?
Perfect.
I need you to repeat that.
Yeah. Roberto, I just sent it to you in a text.
Thank you. Performing provided that.
Mr. Chairman, I don't know. I know there is some public comment and time is running low, but who we've not heard from today are business owners. And I don't know if there's any of them who are looking to make public comment, because this will, have direct impact on many of them. For example, I see Frank Daly. I know he's the new president of the Builders Association. So I'm just wondering if we can hear from some of these public comments who may have concerns about this order as written.
Okay. I know Mr. Hopko had his hand up for a while before Mr. Daly, so I'm going to go ahead and add Mike first, if that's okay. Just unmute yourself.
Okay. Hi, guys. Oh, sorry about that. That picture there. First of all, I want to say thank you and for this hard work and hard decisions you're making. And in my opinion, you enjoy a wide trust among the community here. And I appreciate that. And I really appreciate the making an exception for performers. Our performers are all 10 feet from any audience members and there's no interaction allowed. They're all vaccinated. So I really appreciate that. And back to Jim Cooper's comments, I think that, to the extent that you can maybe separate out mandate orders from recommendations might help clarify the situation for everyone who's trying to enact and we have to a large extent enforce these issues. So if a mandate is a mandate, it would be very helpful, I think, if it was sort of a standalone item and then other recommendations be made as recommendations. So that's my comments. Thank you.
Mike, I believe you're available now. Just unmute.
Yeah, hi, good afternoon. I appreciate the opportunity to speak and the work that you're all putting in. First off, I just want to voice my support for all that the Board of Health is doing and also to again reach out as the president of the Nantucket Builders Association to say that we hope to work in lockstep with the town to ensure the safety of the people in the building trades, the people who come here that we service, and the community at large, healthy and safe. I think collectively we did a fantastic job this past year and a half in really getting this under control, and we stand ready to do that again. I also have a comment about what we're talking about right now with the performers, and this is kind of utilizing this talking point to go into a bigger subject matter, which is I think we start getting into a very dangerous position when we start picking certain exclusions. I think what worked so well in the beginning and when we really got this crisis under control is that you guys had very distinct points, very distinct qualifications of what we could and could not do. There weren't exemptions for certain areas. It was blanketed. It was all or it was nothing, and it worked. And I think if we start picking out, well, this industry can do this, but that industry can't do that. A performer is fine from being apart from the public, but they're on stage with other people. There are other performers. And then I have to justify to or explain to my staff why they can go and see a performance where those rules are different than what they get to do. I think it just gets very muddy very quickly. And then we're all of us are going to have to start answering questions that we're not prepared for as to why do some people get to do some things and other people don't get to do that. And then it kind of just starts unraveling. So I would ask and implore that this board have a blanket statement, keep it very, very simple, have it the same for everybody, regardless of industry. And I think we can get this under control very quickly like we did last time. Thank you.
Thank you.
Sorry, my mouse is. Mr. Hoey, just unmute yourself.
Can you hear me?
Yes, sir.
2 points I'd like to make. The first is sort of a point or a request for clarification on Articles 2 and 3 of your order. If someone is renting their property for a wedding and there's 150 people outdoors under a tent, I think they're exempt. And my question is, bad weather comes, they drop the flaps. That tent is now an indoor facility rather than an outdoor facility, I assume. And I think you need to say that, or people are not going to interpret it that way when that event occurs. The second point I'd like to make has to do with effective dates. I certainly would recommend that the order that you're considering today have a relatively quick effective date, but with respect to whatever decision you make with respect to occupancy, you probably need to give some warning because of all of the events that are taking place and all of the caterers and so on. And if we have a crisis on the island, you need to have an effective date that's fairly soon, but try to think of some way that you give a heads up to people that are trying to make decisions as to whether to cancel events or not, with respect to the order that you may pass relative to occupancy. That's all I have.
Thanks, Peter.
Thank you. As far as the tent goes, I believe this, Amy, correct me if I'm wrong on this. I believe the state already still has it in place that, oh, my light's going out again. The state says that when more than 50% of the flaps are down on a tent, it's considered indoors, correct?
Correct. Yeah, that's what I was meaning before. 50% airflow was a definition that we dealt with from the very beginning as far as indoor versus outdoor. I'll pull one, say slip 14, has some sides. When it rains and pulls down, it does switch if they don't have at least 50% airflow. So that's a definition we've dealt with from the beginning. Correct.
That's good. Catherine, thank you.
Hi, Roberto, Chair Stephen. I just wanted to quickly say that number one, related to giving employers or businesses a heads up advance notice. A, the virus is not giving us an advance notice, so that concept is erroneous. And B, I would like to ask that the board does vote in favor of a simple order that says masks should be required indoors. Recommendations related to that could be easily handled, but a simple rule that's easy to follow is the best thing for us to be able to explain to our customers and our visitors how to handle this spike. Thank you.
Thanks,
Done.
Kathy. Jim?
I agree with that person that just spoke. I have a simple thing to say. We're here to present an order. An order means something that we want people to do. I don't think there should be any recommendations at all in this order that we present today. Recommendations, all they do is water down the order that we want to present and we want to give to the people for what the Board of Health wants done. And it should be the simplest thing that we could put on paper.
That's fair. Melissa, you have your hands up too.
Thank you. I guess along those lines, the communication strategy for the order, I think we've found this over the past year and a half that, and Amy, I know that you were on the economic task force, and that's a great group of collaborative business members, but perhaps that's where the recommendations are communicated from the health department, because I think clearly you have them, the blessing of this board for those recommendations. You don't need them to communicate them. And I think with everything, communication is going to be the critical piece of making sure that everyone understands, to Kathy's point, what the rules are. And we need these organizations like the Chamber of Commerce, the Restaurant Association, the Real Estate Association, the Building Association to communicate and partner with us on this. So are those connections still in line? Do we have a strategy around that? Or what do people think about having that be where our recommendations are communicated?
You can definitely communicate recommendations through another method. That's totally fine. We have the town website, the summer 2021 page, the coronavirus page, social media, town. We can push out all our recommendations. Last time we did our recommendation, which we called advisory, we received a lot of half of a peace sign, is what I'll call it, or also known as a one-fingered salute. So we received a lot of those when we did our advisory, which is why we're at an order at this point. So recommendations are being received very poorly in the United States because we're an individualist society, not collectivist. Then we have one.
And if I can just quickly follow up, Amy, if there's a communication on that order, could you send to those groups? Could we ask you to do that, to ask for their assistance in broadcasting whatever the order and recommendations are?
Yes, absolutely. We have great communication with all those groups, especially the restaurants, and then even through this event workshop, we have been communicating. Right. So yes, we have gotten a lot of great group lists together in the past year.
Thank you. That means a lot. Thank you very much.
Yeah, we have a lot of email addresses from everyone we permitted. We have one last public comment. It is, so just a moment. Bruce, just unmute yourself.
Oh, sorry about that. No, I guess my hand didn't get lowered. I just would like to compliment everybody on where they're dealing with this, but I still believe that there's a sense of urgency needed here for a policy addressing some of these restaurants who decide not to notify us that there's an issue at the place, so that we can make an intelligent, informed decision. And I would hope that you would consider that going forward. But thank you all for everything. I'm sorry I didn't lower my hand.
We have one more. There was just one. Yes, Charity, just unmute yourself.
Intelligent, informed decision, and I would hope that you would consider that going forward. But thank you all for everything. I'm sorry I didn't lower my hand.
Charlie, can you mute your TV or the mute YouTube in the background before you speak? We have one more. It was just one.
Can you,
Charlie, just unmute yourself.
can you hear me?
Informed decision, and I would hope that you would consider that.
See, I think that happens when you have two different.
Charlie, just unmute yourself.
Can you hear me?
Yeah, but there's too much background noise to have a TV or YouTube or something.
Uh-oh. Can you hear me now or not?
Yes.
Yes.
Thank you.
The question I have is if you are going to essentially mandate this, and I think I read that you're
See, I
using.
think that happens when you have two different.
Can you hear me?
Yeah, but there's too much background noise to have a TV or YouTube or something.
Uh-oh. My only question is, can you hear me now or not?
Yes.
Okay. The question I have is if you are going to essentially mandate this, and I think I read that you're
See,
using.
I think that happens when you have two different.
Charlie, can you please mute whatever video you have in the background? Yeah, but there's too much background noise to have a TV or YouTube.
Okay. My only question is, can you hear me now or not?
Yes.
Okay. The question I have is if you are going to essentially.
Can you email us Charlie, can you email us your question? It seems we need to move on.
Before we take a vote on the order, could we just look at it on the screen another time? Because I know it's been amended.
Absolutely.
Thank you.
So I know, did we want to remove this recommendation section? I don't know what the decision of the board was at that point.
My personal opinion is it's very clear the way it's written right now, and I would like to see it in there, but if board members feel like that's not clear enough and takes away from the order, or if they'd like the order to be written first and recommendations at the bottom, that's fine, but I do think it's important that we communicate on the difference between what's mandated and what's recommended.
It's whatever the decision of the board is.
Malcolm?
Yeah, I agree. I mean, it's very clear what the order is in this format.
I feel the same. I'm fine with the way it's written too. I don't want to try to reinvent the wheel.
So then the biggest substantive change, and sorry for the people watching on TV that's moving quickly, is we're not going to do the 75% occupancy section, but we're adding that the mask requirements shall not apply to performers. Is this okay with the board?
Yes.
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 Okay, and those were the only changes.
I'm sorry, it's Melissa. The only other consideration, I know that Jericho and Amy had mentioned it from B-Town, and I think it may read it something like indoor bar and dance venue customers may only remove face coverings when seated at tables or seated at the bar. I'm not sure if that kind of language is necessary or recommended, Roberto. I would defer to you.
Yes, the P-Town one is indoor bar and dance venue customers may only remove face coverings when seated at tables or seated at a bar. Patrons standing or ordering at the bar must be masked, and guests must be masked on indoor dance floors. So if the board is willing to add that, I can. It's entirely up to you five.
I'd be very comfortable adding that. I don't think there's any harm in adding clarity to how those high risk situations are expected to operate, but that's just my opinion.
So I feel like it would fit here. face coverings. Let's see, we have tables, we're seeing it.
While you're writing that, Roberto, I think the only other thing we need to determine is the start. And I'm happy to have this effective immediately. I don't see any reason why it couldn't be.
I think we should, I'm sorry, Melissa, can you say that again?
Roberto, you misspelled one word there.
Where?
When at the bar, you got much be masked.
Thank you.
There you go.
And we should probably add restaurants to this as well.
Mm-hmm.
All right. How does the board feel about this? Okay, 16,000 version once we're done.
I mean, that looks good. And, you know, just to let people realize it isn't any different than what we were doing almost 3 months ago, except the only difference in this order is that you don't have to wear your mask once you step outside the door of your house. So.
Very similar to what we passed before. Except now we know more. We have, like I said last night, we have the data on previous engagements. We know what works. We know how it works. So we can narrow it down. So I will zoom out on this. And then what we will do is that in order to maintain the same naming conventions, we should just call this order number 16 so that we can continue on from there. And then since it's just the masks and we're going to be dealing with occupancy on a later date, would the effective date be today?
Yes.
All right. Okey-dokey.
Roberto or Stephen, can you hear me?
Yes.
I just had a very small grammatical note on what Roberto just wrote in.
Okay.
Indoor bar, small I, hyphenate indoor bar.
You're the best, Terry. Thanks for looking out for us.
Jericho, the editor here, is just like throwing a party right now. I can see it. Thank you, Terry.
I'd make a motion to approve emergency order 16 effective immediately.
I'll
second.
Okay, all in favor by roll call vote as I see you. Jim Cooper,
Aye.
Malcolm McNabb,
Aye.
Melissa Murphy,
Aye.
Meredith Lepre,
Aye.
and Steve Visco, chair, says aye.
Thank you, Roberto, Jericho, and Greg.
Thank you all.
Thank
Do you
you.
need a motion to adjourn, Steve?
Yes, I do, yes.
Before I do that, could we, do we have any clarity on when we might meet next regarding occupancy? Would that be Wednesday, Tuesday?
We'll get to work on that as soon as we can, as soon as we have the paperwork. I'm not going to get that to you. I would suggest sometime next week, but we also need to make sure when the webinar time is available. So
okay,
we'll go from there.
Great. So we'll be on standby for that. Okay, with that, I'm happy to make a motion to adjourn.
Second,
Okay, all in favor? As I see you, Jim Cooper,
yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
Mayor Plepri, and Steve Disco says aye. Okay, everybody, thanks for coming on such short notice.
Thank you, everyone.
Thank you.
So, Roberto, you'll send all that stuff to us before? Okay.
Yes. Yes, I will send a cleaned up version shortly.
All right, thanks.
Thank you.
Thank you.
Take care.
Oh, hold up, we're still live.